Florida CNAonlineCourse.com presents Skill 6, Feeding a Resident. Knock on the patient's door, then enter. Greet the patient by name and introduce yourself, what you're going to be doing. Make sure they're okay with that. Then you're going to provide for privacy by shutting any sort of curtains or whatever that may be in the room. Then go wash your hands, come back, check the patient's ID, then gather your supplies and place them on a tray table that's covered inside the room by the patient, what have it. Go to the sink and wet a washcloth. When you're wetting it, please make sure to use a paper towel to turn on and off the sink. That way you do not contaminate your hands. Return to the room and ask the patient if it's okay to raise the bed to 60 degrees. Then raise the head of bed to 60 degrees. Cover the patient's chest with a protector. Then sit in a chair eye level with the patient. Check their food chart. Make sure they don't have any allergies and make sure they're eating what they're supposed to be. You're going to make sure it's also the correct name on the chart. Pour them a cup of water from the pitcher. Ask the patient if they would like their hands cleaned with a warm, wet washcloth. That would be the cloth that you washed at the sink. Now you're ready to start feeding the patient. Always ask the patient what food they would like to eat first. Then start to feed with the spoon, not all the way full. Go in a clockwise fashion, eating different things each time. About every 3 bites, ask the patient if they want a drink and give them one if they do. Always encourage the patient to eat as much as they can, and pat dry the mouth as needed. You'll be using the cloth to pat dry as needed. During this whole process, make sure you are communicating with the resident. When the resident is full, ask them to try one more bite. Always use encouragement. Now, put the food back on the shelf and leave the water if allowed. Also, inform them that they need to be upright so that proper digestion can take place. Place dirty linens in the hamper. Wash your hands. Give the patient their call light, and unprovide for privacy. After all this, record what food and water the patient eat or drank on the intake chart. Thanks for watching. Please leave feedback on our feedback page.